Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I would like to present our research about knowledge, perception, and awareness of adolescents' reproductive health in the School of Muallimat Muhammadiyah Yogyakarta. This program is an effort to improve mother and child health through adolescents' reproductive health education for the students at Madrasah Muallimat Muhammadiyah Yogyakarta with the team leader, me, Supriyatiningsih from Department of Obstetric and Gynecology, Faculty of Medicine and Health Sciences, Universitas Muhammadiyah Yogyakarta, as well team members, Dianita Sugio from Department of Nursing, and then Lydia Febrianti from Department of Midwifery, Stikes Gunabangsa, Yogyakarta, and NZ Kurniawan from National Population and Family Planning Agency or BKKPN, Special Region of Yogyakarta. Our introduction are backgrounds related with the problem to sexual and reproductive health among adolescents as our major concern in low-middle income countries. Adolescents' pregnancy and child marriage are more likely to occur in poor, low-educated, and rural communities. Adolescents are greater risk for unsafe abortion, young maternal death, violence, and sexually transmitted infection, including HIV/AIDS, as well as the social consequences of the school expulsion, child marriage, and poverty. This study is to investigate this knowledge, perception, and awareness regarding adolescents' reproductive health in the school. The target of this study is the establishment of the Reproductive Consultation Center for the students, and this research scope is about reproductive health. Our methodology, we use the qualitative study as an observational analytical. A primary data we gain from the questionnaires. The questionnaire consisted of the knowledge, perception, and the awareness about menstrual pattern, prevention of the pre-sex, and HIV/AIDS. The study was conducted at the school Muallimat of the Muhammadiyah Yogyakarta with the sample size of the study was 112. Data gathering from the informed consent, pre-test, education, and the post-test, and the analysis, we are using the SPSS 25.0 in the univariate and bivariate. Our result, from the characteristic of the female living together and then occupation, at the table 1, so that the respondents were females in the range of the age 12 until 17 years. And most of them, they are living with their parents and work, and their parents work as a government employees. At the table 2, we look at about the indicators about their knowledge of the adolescents in the reproductive health, especially about the knowledge about the sexually transmitted infections and the adolescent's pregnancy. We look at from 148. Finally, we have 148, so that adolescence is related to the knowledge of the reproductive health. And at the table 2, we look at also the characteristic about this disability status, chronic disease, the long hospitalization less than 6 months ago, exercise habit, and menstrual pain, and also the frequency of changing napkins. Average, the respondent had regular menstrual cycle 62.2, experienced menstrual pain 60.1. The majority of the respondents changed napkin more than 3 times, 56.8. And most of the respondents did not have any chronic disease, 98%. So here we conclude that the knowledge, perception, and awareness of the adolescents in the reproductive health are influenced by the knowledge about sexually transmitted infection and adolescents' pregnancy. Adolescents who have sufficient knowledge about reproductive health are more likely to be able to protect themselves from the bad risks of the STIs. The role of parents and teachers is very important and dominant in providing information about the reproductive health. Therefore, the parents and teachers need to get socialization related to parenting for adolescents. This is our activities during online and offline, and this is our workshop, what we call this as a case pro remaja. So thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.